For intercourse, which can be very painful, you want to use a lubricant, but you want to use a lubricant that's designed for intimacy. Dealing with vaginal changes during menopause really is determined by the degree of changes. It's called vaginal atrophy, and it's a terrible, terrible word. I try never to use it with my patients. But with the decreased estrogen, the walls become thin and pale and less stretchy. In a more mild situation, simply restoring some moisturizer might be enough. For intercourse, which can be very painful, you want to use a lubricant, but you want to use a lubricant that's designed for intimacy. That seems to be the code word on the package. For some reason, the pharmacy can't say sex, I guess. So you have to read the package label carefully, and if it says something in there about intimacy, that's the one you want. Typical lubricants, say the ones we would use in an office, they're going to get dry in a minute or two and won't work for intimacy. And then a woman with more severe vaginal atrophy, restoring the estrogen in a local way.